So your child may have been referred to an otolaryngologist to consider getting their adenoids and or tonsils out for enlarged adenoids and tonsils, or for chronic tonsil infections, or for chronic sinus issues, especially in small children related to enlarged adenoids. So what to expect from this surgery? So the adenoids are a very small amount of tissue way in the back of the nose, and the tonsils, as you know, are on the sides of the throat and the way in the back behind the tongue. So typically with this surgery, it's done as an outpatient. It can be done in less than an hour for most patients, and typically you go home the same day. There are many ways to remove tonsils, but all of them have, and adenoids, but all of them have the same risk. There's a small risk of bleeding after tonsillectomy up to 2 weeks after surgery. So it's really important to use a soft diet. Don't eat anything hard or sharp after surgery, like chips or crackers. Be careful with granular items. And the other risk for the adenoids is, besides bleeding infection, is that when the soft palate closes, there's a very rare 1 in 1,000 risk that when it closes, there'll be a gap and air would shoot the nose on certain sounds. All of these, again, are rare, but it's something that if you ever have a problem, it's something to call your physician about immediately. After surgery, it can be up to 2 weeks to recover. Every child is different. Pain is usually up and down. They'll actually do well for several days after surgery, then get worse. And then they start getting better. There's a scab where the tonsils were that falls off day 5 to 10 after surgery. Typically the bleeding happens when this falls off. Sometimes it's just a little bit, sometimes it's more enough to warrant a call to the physician. And we now usually alternate Motrin and Tylenol after surgery, so it's very rare for children to ever need narcotics. For foods, anything soft, so mashed potatoes, noodles, oatmeal, things like that are very good to eat. Typically, we say avoid anything that's really large, hamburgers until 2 weeks after surgery. And dairy is actually, especially ice cream, you always heard that it's great to eat ice cream after tonsillectomy. It's actually not, because you get thick saliva with dairy products, and that's really annoying when you've had tonsillectomy. Sherbet will work great.